Okay, so time to move on. Now we have EUPSA. This is an old friend of ours. They were with us last years, and now we have two presentations from them. Actually, they chose three, but unfortunately, one of them couldn't make it today, so we only have two. But they are the best from EUPSA this year. So first, we have Dr. Lieke Josephine Van Hern, that it's a pediatric surgeon from the Department of Pediatric Surgery in Emma Children's Hospital in Amsterdam, and she brought to the ring risk of malignant transformation and tumor recurrence of sacrococcygeal teratoma, a multicenter worldwide retrospective study, and their aim to assess the risk of malignant transformation of this sacrococcygeal teratoma at primary resection and risk of recurrence with risk factors after the resection. And then we have Dr. Rebeca Figueira from the Hospital of Sick Children's. With fetal lung vascular development is reduced by amniotic fluid stem cells, extracellular vesicles, in experimental congenital diaphragmatic hernia. So this study aimed to investigate whether the antenatal administrations of AFSC EVs rescue fetal lung vascular development. So two very interesting works, and let's see what the poll says.
Have you checked out the new Stay Current app update? There's a new space. The European Pediatric Surgeons Association has joined the Stay Current app with questions, videos, and lectures so we can continue to spread knowledge about pediatric surgery to surgeons across the world. Plus, get ready for our new EUPSA question re-release series, coming to you soon. Until then, remember, knowledge should be free.
Okay, so it was also very tight and the poll is going crazy, but we have one to show that it's the one from Dr. Rebeca Figueira from Hospital Sick Children with fetal lung vascular development. Is reduced by amniotic fluid stem cells, extracellular vesicles in experimental congenital diaphragmatic hernia. So we have the video there. We can play it now.
Wait a second. Hold on. Did Hospital for Sick Children win last year? No, I know it was CAPS that won, but not EUPSA. But it was I thought it was Sick Children. All right, let's go ahead and play that video.
I mean, she.
Chairpersons, ladies and gentlemen. Fetal lung vascular remodeling predisposes fetuses with CDH to postnatal pulmonary hypertension, which plays a central role in the poor outcomes of these babies. There's consensus that the prenatal period offers a window of opportunity to promote normal lung development. However, no antenatal treatments tested to date have been successful. In search for a therapy that could fully rescue normal lung development, our lab started studying extracellular vesicles derived from amniotic fluid stem cells. We reported that AFSEVs promote growth and maturation in fetal hypoplastic lungs, and that these beneficial effects were exerted via the release of RNA cargo. With these studies, we have demonstrated that AFSEVs improve fetal lung growth and maturation. But what about vascularization? The aim of this study was to investigate whether antenatal administration of AFSEVs would also rescue fetal lung vascular development. We isolated the AVs using ultracentrifugation and characterized them in accordance with the International Society of Extracellular Vesicles guidelines. We used the well-established nitrofen model of CDH in rats and performed the antenatal approach at E18, where either saline or AFSEVs were injected into the amniotic sac. At E21, fetal rat lungs were harvested and allocated to control in CDH plus saline or CDH plus AFSEV treated groups. Fetal lungs were assessed for vascular density, mean wall thickness of pulmonary arteries, and the gene expression of angiogenic factors. Moreover, we calculated the full-tone index, which expresses the degree of right ventricular hypertrophy, an indirect marker of pulmonary hypertension. We observed that vascular density was rescued back to normal levels after AFSCV administration, and that vascular remodeling was also attenuated in CDH-treated lungs. Gene expression analysis revealed that angiogenic factors were rescued back to normal levels after AFSCV treatment. Moreover, AFSCVs attenuated the severity of right ventricular hypertrophy in CDH hearts. But are these findings relevant to human fetal lungs? To address this question, we first isolated and characterized EVs from GMP-grade human AFSCs and used our human fetal explant model of pulmonary hypoplasia. Lung explants were divided into 3 groups: normal, hypoplasia, and hypoplasia-treated groups. At 96 hours, lungs were harvested and assessed for markers of vascular development. We again observed that vascular density was restored by AFSCV treatment, as well as vascular remodeling was attenuated in hypoplastic-treated lungs. Similarly, gene expression analysis showed that angiogenic factors were rescued back to normal levels after AFSCV treatment. After these very exciting findings, we then asked, what are the lung endothelial cell-specific responses to AFSCV administration? To answer this question, we performed single-nucleus RNA sequencing on the left lung of fetal rats. When we analyzed the endothelial cells by condition, we observed a striking difference between control and CDH in the pattern and distribution of endothelial cells, which was rescued to normal distribution following AFSCV treatment. We identified 245 differentially expressed genes, and we observed that these genes regulate vasculogenesis and angiogenesis and were downregulated in CDH lungs and upregulated in CDH-treated lungs. The rescue of endothelial-cellular interactions in the treated lungs can be explained by AFSCV cargo that contained some known microRNAs that control processes like angiogenesis and proliferation and migration of vascular endothelial cells. In conclusion, AFSCVs rescue vascular development and attenuate vascular remodeling in rat and human fetal hypoplastic lungs. They also modulate angiogenic processes and rescue the expression of genes involved in lung vascular development. AFSCV cargo contains some microRNAs that regulate lung vascular development, pointing to a mechanism of action. Therefore, antenatal AFSCV treatment is a promising avenue to restore normal vascular development in hypoplastic lungs and potentially prevent postnatal pulmonary hypertension in babies with CDH. I would like to thank the lab and all the sponsors listed, and you for your attention.
All right. So we're back. All right. We're going to have to disqualify you from this event in the future because you're too good. You guys keep winning. And by the way, before we're going to add an extra, Ellen, add 30 seconds to the timer because I just want to say something. So a little thing to let everyone be aware of is, so we had 1,700 people sign up for this event. And last night we sent out an email to 1,700 people with the login instructions, and Google thought we were spamming. So they put our email on hold. So if you have a question or a comment, email me, tponsky@gmail.com, until we can explain to Google that we were not spamming by sending out 1,700 emails. All right. Let's hit the discussion. Very impressive paper. Tony?
Yeah, fantastic work. Congratulations. It really is impressive.
Thank you.
Obviously, the next phase is how do you translate this to patient care? Would you imagine using the microRNAs that you've identified that have these effects, or would you use the whole AFSC EVs in a way of trying to transduce? And then in follow-up to that, how would you give it to the baby? How would you get it into the fetal lung, or could you give it to the mother that would then get to the fetal lung?
Yeah, thank you for your question. These are really very pertinent questions. So first question, we already have ongoing studies in large animals. So the first step to translate it into clinical is to study this treatment in a large animal of large animal model of CDH. So we're doing the lamb. We wanted to make sure that we know the right dose, the right route, and to see if we will need or not multiple administrations of the same treatment. And following for the second question, yes, we do want to give the EVs as the cargo itself is the most important part of it. And we know that the murnas are one of the let's say the main components of it, but we also do know that there are other things. So the EVs as itself are like less immunogenic, and then we can also make sure that the babies are receiving the whole cargo and not only the murnas. So we do know that the murnas have a great, it makes a difference in the treatment because it has the specific, the ones that were highly showed in the EV cargo, but we also know that the other components are important as well. And for the following, how we would give, so I would like to actually mention a paper that was published in the New England Journal of Medicine that actually even was published in the New York Times. I don't know if you guys had any idea of it, but it was really interesting, and it was in utero treatment for an enzyme replacement therapy. And they did it they used the umbilical vein as like a way to administer the treatment. And they did it at multiple times, at least 6 times every second week. So that would be also a way to do it. So far, we do want to do a less invasive type of treatment. So we have tested that not only intramniotic, we're also doing, trying to do in the large animals intratracheally. But let's say in the future, we have experiments as well and giving it to the mom. So we can administer to the mom, give it to the vein, and then intravenous. And we do know that the disease, they reach the lungs. So that's also something that could be applicable in the future, because I think the less invasive, the better for the mom and the baby.
Okay, Tony, do you have a final comment before we go, or are you good?
For the sake of time, I'm good, but fantastic work, Rebecca. Keep it up.
Thank you.
Thank you so much.
Thanks for joining us. And by the way, I've been criticized in the past, rightfully so, because the way we chose papers was me saying, oh, that's a good paper, which we all know is about the worst way to decide a good paper. But what happened was Augusto Zani, rightfully so, said, Todd, you keep choosing papers that are procedural based. What about basic science? I said, I'm not smart enough to understand basic science, so I never choose those papers. And they keep winning. So clearly he was right. People do want to hear about the basic science.